If you'll give me a few minutes, I'll enlighten you. One of the biggest arguments against health care for all or national health in the United States is when people say, why should their tax dollars go toward paying for other people to have health insurance? Why should we pay for that? Well, what if I told you, number one, you already are, and you're doing it in two ways, and the only thing you complain about is the bill. So first of all, let's talk about tax dollars. Did you know that insurance organizations get subsidies for what they prescribe? The high prices of what they prescribe. Of course, the same drugs are a tenth of the price in other countries. The same drugs manufactured by the same people. But the insurance companies get subsidies. One of the things that I do is that I work with people to reverse their diabetes. And I've talked to a number of doctors. One of them told me an amazing story. His patients, because he was doing a lot of the things that I do with my clients, his patients were going off insulin. They didn't need their medications anymore. And eventually someone from the insurance company approached them and said, why are you taking people off of their medications? And he says, isn't that great? No, it isn't. Because they were losing now money for not prescribing those medications. 1995 and 1996, I worked in a place called AIDS Project Los Angeles. I was in a group of people, amazing group of people in my little department. The head of my department was a physician. And someone said in one of our meetings that they would give up their jobs in an instant for a cure. And my boss very casually said, oh, that's not going to happen. And of course, our eyes, it's like, what? Our eyes opened up. He said, oh, no. They'll make AIDS a manageable disease so they keep people on medications for the rest of their lives. This has happened with other medications too, but it has happened with AIDS medications. It has. So, my gosh. For the rest of their lives. Somebody's making some money, and somebody's getting kickbacks, or somebody's getting something, and it ain't us. All right? There's absolutely a third thing that is important. The way health insurance works, one of the big problems that Obamacare had is that young people who thought that they didn't need insurance weren't buying it. And they wanted to force people to do this and penalize them for not doing it. But why was that? It's because people who don't need their health insurance are actually subsidizing the people who do. Now, in a future video, we're going to talk about where that disease actually may come from. But we'll talk about that later. I want to talk about that because I believe our society has actually created a sick society, an ill society. But that's another issue. So when your insurance premiums go up, the hospitals are charging high prices. They're prescribing drugs that are being paid for at 10 times the cost of those drugs in other countries. And so you're getting double dipped. Number one, your premiums have gone up because somebody's got to pay for this, right? And number two, your tax dollars are already going, a portion of them, already going toward those subsidies that are inherently being maintained. It's insane. It's nuts. but it is the biggest money-making scheme on the planet. Why? Because it's your health. You have no choice.